USMLE style question. Medial geniculate nucleus, MGN, of the thalamus. A 47-year-old man presents with difficulty understanding speech in noisy environments. He reports hearing loss in both ears, but it is more pronounced on the right side. His Weber test lateralizes to the left ear, and the Rin test is normal bilaterally. Further examination reveals difficulty localizing sound, particularly when the source is on his right. MRI reveals an ischemic stroke affecting the left thalamus, including the medial geniculate nucleus, MGN. Which of the following functions is primarily affected in this patient? A. Visual processing. B. Auditory relay to the primary auditory cortex. C. Balance and coordination. D. Proprioception from the contralateral body. E. Somatosensory relay from the face. Answer B. Auditory relay to the primary auditory cortex. Explanation. The medial geniculate nucleus, MGN, of the thalamus is responsible for relaying auditory information from the inferior colliculus to the primary auditory cortex in the temporal lobe, Haskell's gyrus, Brodmann area 4142. Damage to the left MGN affects bilateral auditory processing, but since most auditory input is bilateral, patients typically experience difficulty localizing sound and hearing in noisy environments rather than complete hearing loss. Why other choices are incorrect? A. Visual processing. The lateral geniculate nucleus, LGN, not the MGN, is responsible for visual information. C. Balance and coordination. Handled by the vestibular nuclei and cerebellum, not the MGN. D. Proprioception from the contralateral body, relayed through the ventral posterolateral nucleus, VPL, not the MGN. Somatosensory relay from the face. The ventral posteromedial nucleus, VPM, processes sensory information from the trigeminal nerve, CNV, not the MGN. Clinical relevance. MGN lesions cause bilateral but asymmetric hearing deficits, often presenting as difficulty processing complex sounds and localizing auditory sources. The MGN is part of the auditory pathway, receiving input from the inferior colliculus and sending signals to the primary auditory cortex in the superior temporal gyrus. Common causes of MGN damage: thalamic stroke, posterior cerebral artery, PCA infarct, multiple sclerosis, MS, lesions, brainstem tumors affecting the auditory pathway. Would you like additional thalamic-related or auditory pathway USMLE questions?